Welcome everyone to this professional development training workshop for Liberty University Nursing Department. My name is Cedric Jackson and have been invited to serve as a consultant to guide this department in preparing for accreditation and strengthening assessment practices. Today's session is focused on developing the knowledge and skills that stakeholders across the department need in order to carry out assessment process effectively. Accreditation is not just about compliance, it is about demonstrating quality and fostering continuous improvement. This presentation will address key areas such as identifying program outcomes, selecting assessment methods, using results for improvement, and preparing documentation that aligns with accreditation requirements. Our purpose is to provide practical tools and guidance that will empower faculty, staff, and administrators and partners in the department to carry out their responsibilities with clarity and confidence. Since Liberty University is a Christian institution, we will also look at biblical foundation for assessment and accountability, reinforcing how our efforts align with faith and mission. By the end of this session, you should have a clear understanding of how to build and sustain an assessment process that serves students, support accreditation, and honor God in His excellence. Now we will start our slides. This agenda allows the roadmap for our training today. We will begin with an overview of the nursing department at the Liberty University, its mission, and how it fits within the larger university context. Then we will look closely at the key programs and services offered by the department, which are central to accreditation reviews. Following this, we will identify the department stakeholders such as faculty, staff, students, and community partners, and we will define their role in assessments and accreditation process. Next, we will reflect on Christian worldview foundations for our work. This grounding is critical because assessment is not simply an administrative exercise, but a matter of stewardship and service. We will then discuss accreditation standards, focusing on those most relevant to the department. From there, the training will shift to practical tools. We will cover how to develop a clear and measurable outcome, how to select appropriate assessment methods, and how to analyze data. We will then move to strategies from using results to make meaningful improvements. Finally, we will conclude with a sample assessment report that you can serve as a model for the department's future self-study contributions. The overview. The Liberty University Nursing Department is one of the university's flagship programs and plays a vital role in preparing graduates for healthcare professions. The department's mission is to prepare nurses who provide competent, compassionate, and Christ-centered care. Nursing is unique in that it requires both technical expertise and moral responsibility, which makes assessment accreditation especially important. The department offers multiple degree pathways, including undergraduate, graduate, and doctoral programs, which serve a diverse body of students. Faculty interrogate Christian faith with evidence-based practices, ensuring that students learn not only the science of nursing, but also the values of compassion and service. The department is also committed to excellence in teaching, scholarship, and community healthcare engagement. It strives to prepare graduates who will make a difference both locally and globally. Understanding the department's scope and mission is critical because accreditation evaluates whether programs align with stated mission and goals. Assessment ensures that this mission is more than words. It demonstrates through evidence that students are achieving intended outcomes. By maintaining a clear mission-driven approach, the department ensures consistency between faith, academic quality, and student success outcomes. Now, this pretty much talks about the department overview, and it just basically talks about, the nurses, how they prepare. Nurses with strong clinical expertise. And it talks about the mission where it focuses on holistic care and align with biblical Christian worldview. And it also comes down to say programs with the graduates and undergraduate professionals, and with the nurses with degree paths. And it also talks about faculty, faith with evidence-based practice in all teaching and services, and what the department emphasizes on the excellence in teaching, scholarship, and community health care service. We're going to go with the next slide. Next slide. We talked about the programs and services in the academic program and student support, and it also talks about the facilities and career development. The Liberty University Department provides a range of programs and services that students support learning and professional development. The Bachelor of Science in Nursing is designed to equip students with the knowledge and skills needed to deliver safe, patient-centered care. It emphasizes clinical competence, ethical decision-making, and the integration of faith into practice. The Master of Science in Nursing focuses on preparing advanced practitioners, nurse educators, and leaders who can influence healthcare delivery and outcomes. This program is essential for those who want to advance their careers and make broader impacts in the field. The Doctor of Nursing practice represents the highest professional degree and prepares graduates to lead healthcare systems, influence policies, and contribute to advanced scholarship. In addition to degree programs, the department provides academic advising services to help students plan their studies, stay on track for graduation, and meet licensure requirements. Student mentoring services also play an important role in supporting professional growth, leadership development, and integration of Christian values into practices. Each of these programs and services must be assessed for effectiveness to demonstrate the quality and ensure accreditation compliance. Stakeholders and the roles. Stakeholders are central to both assessment and accreditation, and each group has a distinct role to play. Faculty are primarily responsible for developing curriculum, delivering instruction, and evaluating whether students meet learning outcomes. They also design and implement assessment measures that align with accreditation standards. Staff members provide critical support behind the scenes. This includes managing student records, coordinating clinical placements, and organizing accreditation documentation. Administrators oversee the big picture by allocating resources, ensuring compliance with accrediting bodies, and maintaining a culture of continuous improvement. Students are also key stakeholders because their performance, feedback, and overall experiences serve as evidence in the accreditation process. Their success is the ultimate measure of program quality. External partners, such as clinical sites, employers, and advisory boards, play an important role by offering practice opportunities and providing feedback on student readiness for professional practice. The nursing department has engaged me as a consultant to help align all these stakeholders' efforts towards a coherent assessment strategy. My role is to guide the department in building a system where each stakeholder contributes effectively to accreditation and improvement. Why accreditation matters. Accreditation is vital for the Liberty University Nursing Department because it validates the quality and credibility of our programs to both students and employers. Without accreditation, degrees may not be recognized, which directly affects students' ability to obtain licensure or employment. Accreditation also ensures compliance with national and state standards, which is especially important in nursing where licensure depends on meeting rigorous requirements. Accreditation requires accountability, meaning the department must use tuition donor contributions and grants responsibility while demonstrating measurable outcomes. This accountability reinforces public trust in the institution. Accreditation also promotes a cycle of continuous improvement by regularly evaluating students' learning outcomes and program effectiveness. The department can identify areas needing change and implement enhancement. Accreditation strengthens the department's reputation, builds partnership with healthcare organizations, and provides long-term sustainability for programs. Finally, accreditation demonstrates Liberty University's commitment to Christian stewardship, showing that institution not only meets external standards, but also exceeds them through value-based education. In short, accreditation is not just a regulatory requirement, it is a tool that benefits students, supports faculty excellence, and builds institution credibility for years to come. Christian Worldview Foundation. As a Christian institution, Liberty University frames assessment and accreditation with biblical worldview. Stewardship is central. The department has been entrusted with resources, faculty expertise, and student potential, and it must manage these wisely. Assessment ensures that resources are being used effectively to achieve student success and institutional mission. Scripture also emphasizes truth. Honest reporting of students' learning outcomes reflect the biblical mandate to live and work in integrity, Christian accountability requires that we measure what we are doing and report it accurately. Service is another essential foundation. Nursing itself is a ministry of service, and assessment ensures that the program equips students to meet the needs of patients and communities faithfully. Faculty and staff must see the work in assessment not as a burden, but as ministry aligned with their Christian calling. Colossians 3:23 reminds us to work with excellence as unto the Lord. By engaging in assessment and accreditation with diligence and honesty, the department reflects Christ-centered values while demonstrating to accrediting bodies that faith and academic quality are integrated at Liberty University. This worldview strengthens the department's distinctiveness and mission alignments. Accrediting agency overview. Liberty reports to Southern Association of Colleges and School Commissions of Colleges, or SAC-SCOC. This is the recognized regional accrediting agency for institutions of higher education across the southern United States. SAC-SCOC's mission is to ensure educational quality and institutional effectiveness. It evaluates universities based on governance, mission alignments, resources, planning, and assessment of student learning outcomes. Accreditation from SAC-SCOC is essential for Liberty University because it validates its degrees nationally and allows students to access federal financial aid. For the nursing department specifically, accreditation also requires alignment with professional accrediting bodies such as Commission and Collegiate Nursing Education, or the CCNE. CCNE focuses on ensuring that nursing program meets standards that prepare students for safe practice and professional development and leadership roles. Together, these accrediting agencies ensure that Liberty University Nursing Department operates with integrity, demonstrate measurable results, and continuously improve programs. Understanding the accreditor's mission and scope is critical because it frames the expectations for assessment. Our department must demonstrate through documented evidence that it is meeting or exceeding standards. Accreditation is therefore both a compliance process and a commitment to institutional excellence. Key accreditation standards. There are two accreditation standards that are especially relevant for nursing department. The first is institutional effectiveness. This standard requires that departments develop measurable learning outcomes, collect data to determine achievement and use results for continuous improvement. This is where assessment plays a critical role. Faculty and staff must demonstrate that students are learning what the program intends them to learn, such as safe clinical practices or professional communication. The second is resource and planning. This standard requires evidence that the department is using resource responsibly and strategically to support its programs and services. Accreditation expects documentation that planning is linked to results, showing that data drives decision-making. These standards apply directly to nursing because nursing education requires significant resources, including laboratories, clinical sites, and faculty expertise. Accrediting bodies want evidence that the department not only has adequate resources, but also use them wisely to achieve learning outcomes. Together, these standards demand that the nursing department maintain a culture of evidence. By documenting results, actions, and improvements, the department strengthens its accreditation standing and demonstrates its mission is being fulfilled effectively. Selecting methods. Developing outcomes is one of the most important tasks in assessment. Outcomes define what students should know, be able to do, or demonstrate as a result of participating in a program. At Liberty University Nursing Department, outcomes must align with the mission of preparing Christ-centered nurses who demonstrate excellence in practice. They must also align with accreditation requirements and professional standards. For example, one program outcome might be that graduates demonstrate safe, competent, and compassionate patient care. This is broad, but it can be made measurable through clinical evaluation. An advising service outcome might be that students create accurate degree completion plans within their first year. This supports retention and student success. A career services outcome could be that 80% of nursing graduates secure employment within 6 months of graduation. In the simulation lab, an outcome might state that students perform essential clinical skills with measurable proficiency. Each outcome must be clear, specific, and measurable, using SMART criteria: specific, measurable, achievable, relevant, and time-bound. Ensures that outcomes are not vague aspirations, but actionable goals that can be assessed. We definitely want those things to be assessed. Assessing outcomes. On this slide, we focus on the structured process of assessing outcomes in a reliable and measurable way. The first step is establishing benchmarks that are specific and quantifiable, such as requiring an 85% pass rate of license exam. These benchmarks create clear expectations for both faculty and students. Next is the important to use consistent rubrics for grading skills like communication, critical thinking, and clinical performance. Consistency ensures fairness across courses and instructors. Data should be collected annually, then reviewed carefully by faculty and administrative leadership. This ensures accountability and identifies strengths and weaknesses at both course and program levels. By comparing findings to previous years, we can recognize trends, whether positive or negative. For example, if communication skills scores decline over 3 years, the data signals a need for intervention. Finally, documenting both the strengths and weaknesses is critical. Accreditation agencies require evidence of honest reporting and continuous improvement. This step demonstrates that the department values accountability and is committed to growth. Assessing outcomes is not about fault finding, but about identifying opportunities to make programs stronger and are more aligned with student success and institutional missions. Using results for the improvement. After assessing the outcomes, the next responsibility is to use the results effectively to drive improvement. The first action is revising course content in areas where student performances fall below expected benchmark. For example, if an exam scores reveal a weakness in pharmacology, additional instruction modules can be developed. Faculty development is also vital. Offering workshops ensure that instructors understand best practices in assessment and teaching strategies. Stronger faculty performance lead directly to better student outcomes. Expanding student support services is another key strategy. Services like tutoring, counseling, and writing assistance provide students with tools to overcome challenges. Clinical partnerships must also be strengthened to ensure students have access to diverse patient care experiences, which supports competence in real-world practice. Lastly, results must guide strategic resource allocation. Budget and staffing decisions should align with identified needs to maximize institutional effectiveness. Accreditation bodies look closely at whether assessment finds translate into tangible actions. This approach demonstrates intentionality and accountability. By consistently closing the loop between assessment and improvement, the university ensures it remains compliant. The university ensures it remains competent, responsive to student needs, and faithful to its mission of delivering quality education rooted in both academic excellence and Christian values. Sample assessment report. This sample assessment report provides a concrete example of how outcomes should be documented and presented. This chosen program is the Bachelor of Science in Nursing, focusing on clinical practice competencies. The outcome statement is specific. Students should demonstrate safe and effective patient care during clinical rotations. This aligns with both accreditation standards and the university mission. The assessment method is a standard clinical evaluation tool reviewed by supervising faculty members using a validated tool ensures credibility of results. The results summary indicates that 82% of students meet or exceeds the benchmark. While this is a strong result, it also reveals that 18% of students did not meet expectations. This creates an opportunity for improvement. The action gap addresses this gap by introducing supplemental lab training sessions, which will give students additional practice, opportunity in a controlled environment. The department also commits to reviewing the skills assessments annually, ensures progress is tracked over time, including all 5 elements programs, outcome method results, and action plans creates complete, transparent record. This level of documentation is exactly what an accrediting agency expects and demonstrates accountability, systematically improvement, and commitment to student success. This is the end of my presentation on the nursing department. I hope everything was well. This is really the first time that I've done something like this. So, good afternoon. This is Cedric Jackson. I have been enjoying this class to this point, and I'm looking forward to seeing some of my classmates' videos and postings so I can get to know the names with a face. And as we continue to keep collaborating with one another, I'm looking forward to seeing you all when it's graduation time. You all have a blessed day. Thanks.